Hey everyone, and welcome to RUBIN'S Mind Lab, where we break down the latest research into what it really means. Ever feel like you are trying to help someone with their mental health struggles, but you are just not sure how best to do it? Or maybe you are a link worker yourself, feeling like your training doesn't quite match the tough reality of your job. This new systematic review is all about figuring out just that for people who work connecting others to community support, especially when mental health is involved. So, what is social prescribing anyway? Think of it as a way to help people feel better, not just with medicine, but by connecting them to all sorts of non-clinical things in their community. These could be local clubs, art classes, volunteer opportunities, or even help with practical things like housing or finances. And the people who do this connecting are called link workers. They're super important because they help people find what they need to improve their overall well-being. But as their job gets more complex, especially with mental health needs, are they getting the right training? That is the big question this research dives into. This paper set out to do something really important. It looked at existing research to understand what training link workers actually get, what training they need for mental health support, and what gets in the way of them getting that training. They looked at lots of different studies, both published academic papers and reports from organizations. To get a full picture, they did this really thorough search process to make sure they didn't miss anything important. Basically, they gathered up all the relevant studies that talked about link worker training, their support needs, or any challenges they face when helping people with mental health and well-being. They found 17 of these studies and then carefully read through them all to find common themes. It is like putting together pieces of a puzzle to see the bigger picture of what link workers need to do their job effectively, especially when dealing with tricky mental health situations. And what they found is pretty eye-opening. It turns out that link worker training needs are layered, and there are some significant barriers. They broke it all down into a few key areas. First up, it's all about experiential learning. Imagine you are a link worker. You are not just handing out leaflets. You are often dealing with people who are really struggling, feeling distressed, maybe even traumatized, and waiting a long time for professional help. This means the work is emotionally demanding and requires real connection. So, training that is hands-on, that involves actually doing the work and reflecting on it, is way more useful than just sitting in a classroom. Think about things like supervision, where you can talk through tough cases with an experienced person or mentoring, or even just having dedicated time to think about what went well and what could be better. These aren't always formal training sessions, but they are crucial for learning how to handle complex situations, manage your own emotions, and keep professional boundaries. One study mentioned that link workers often feel their job is more than just pointing people in the right direction. They're helping people with immediate problems like lack of food, housing issues, or money worries, which are all big things that affect mental health. This learning, this practical support, helps reduce the feeling of being alone in a difficult job. And when this kind of support, like reflective supervision, isn't there, link workers can feel more stressed and there are concerns about them burning out, which means they might leave the job. This is why things like shadowing and working alongside experienced colleagues are so valuable, even if they're not always possible. And when it comes to actually learning face-to-face training is often preferred for sensitive topics like mental health because it allows for real-time discussions and helps build confidence for tricky conversations. Beyond just learning by doing, there are specific skills needed. The research highlights 3 main areas for core capabilities. First, great communication skills are essential. Link workers need to build trust and make people feel safe enough to open up, especially if they've experienced trauma or deep stress. It's about having conversations that go beyond just a quick transaction. It's about really listening and connecting. This is even more important when working with young people, where communication needs to be tailored to their age and life situation. A big recurring issue is learning how to set boundaries and take care of yourself. It is a tricky balance, being supportive and friendly enough to build rapport, but also knowing where to draw the line, especially when you are in systems that don't have a lot of resources, or when people are waiting a long time for other services. The research points out that training for this is often inconsistent. Link workers need to know how to manage the risk of people becoming too dependent on them or of them getting too emotionally involved, all while keeping that trust. Mental health knowledge and how to handle risky situations are also huge. While some training like mental health first aid is a good start, link workers often need more in-depth preparation. They need to know when a situation is too much for them to handle and who to go to for extra help. Sometimes link workers are referred people with really complex mental health crises, and the research suggests they need to know not just the skills, but also the system's limits and how to get people to the right place. For young people, specific training on safeguarding and safety planning is critical, and it needs to be appropriate for their age. Then there is the need for understanding the broader context. Link workers need to know about things like housing, benefits, immigration, domestic violence, and addiction, because these practical issues often lie at the heart of mental distress. It's about understanding the whole picture, not just symptoms. This means they need to be able to connect individual struggles to wider societal issues, and this is where equity becomes crucial. For people from different cultural backgrounds or those facing stigma, training needs to focus on being culturally sensitive and inclusive. It's about making sure everyone gets the support they need, regardless of their background. This means training needs to be about more than just facts. It needs to help link workers develop real cultural competence. For younger people, understanding their specific challenges is also key, and we're seeing new areas emerge too. For example, for older people facing financial hardship, targeted training on how to talk about money issues is important. And in countries like Singapore, digital literacy is becoming a new social determinant. So link workers need to know how to help people access essential digital tools. So it's not just about core knowledge, but a flexible approach to different people and places. Now, let's talk about what is holding things back. A massive barrier is role ambiguity. There is often a big gap between what the job description says and what link workers actually end up doing. They might expect to do simple signposting, but find themselves doing deep emotional support and advocacy, often without much preparation. This can lead to feeling unprepared and increased professional risk, especially when it is unclear where their responsibilities start and end and who they can turn to for help. This confusion is made worse by referral mismatch. Sometimes people referring patients, especially in places like doctors' offices, don't fully understand what a link worker can and can't do. This means people with needs that are too complex for social prescribing can be sent their way without the link worker having the extra training or support they need to handle it safely. There is a real need to educate the people who are making the referrals, so Teresa's shared understanding role confusion also happens at the community level, with blurred lines between formal link worker roles and informal community support, meaning the role itself can mean different things in different places. Another huge barrier is the training systems themselves. They're often fragmented, inconsistent, and don't have enough money. This means people get uneven preparation, and there aren't many chances for ongoing professional growth. Some mandatory training is seen as too basic or generic, even when voluntary sector settings might offer more flexible training. They often struggle with resources and making sure the training actually fits the job. Getting time off for training is also a big challenge when caseloads are high. The way training is delivered also matters. Some training is seen as just going through the motions, and online modules are often less helpful for complex or sensitive topics than interactive face-to-face sessions. And sadly, for specific groups like children and young people, there is often a lack of guidance, meaning they have to adapt adult materials, which isn't ideal. On top of all this, there are issues with how social prescribing is overseen and implemented across different organizations and systems. Scroll Discussion Center, so what is the big takeaway here? The main message is that it is not just about giving link workers more training sessions. It is about making sure the training models actually match the real-life demands of the job, especially when it comes to mental health. This kind of social prescribing is often about deep emotional support, and the system supporting it can be quite constrained. Instead of thinking of training as just a bunch of separate modules, we need to see it as part of the essential infrastructure that allows link workers to do their job safely, sustainably, and in a way that fits the local context. This means that things like supervision, having a space to reflect, mentoring, and opportunities to work through difficult situations with others are super important, more so than just standardized online courses. This view of training as part of the service model itself is crucial. It's also clear that training needs can be fixed in isolation. We shouldn't think of link workers as replacing clinical mental health professionals. Instead, the research highlights the complex emotional and relational work they do when services are delayed or when it is unclear how to escalate a situation. Some of what looks like a training gap might actually be link workers having to absorb uncertainty and emotional burdens that are generated by the system as a whole. So, to truly help, we need clearer job descriptions, better education for those making referrals, agreed upon thresholds for who link workers can help, and clear pathways for escalating cases. Without these, training alone won't solve the problems. And when it comes to providing support equally, we can't rely on link workers just happening to have the right background knowledge in mental health or culture from their previous experiences. This leads to uneven service for people. A better approach would be to have a core set of training for all link workers combined with extra, tailored training for specific local needs, like working with children groups. or people facing poverty. This makes sure everyone has the right skills without overtraining everyone for things they might not encounter. So, what can we do at the individual link worker level? Training should focus on communication for safe disclosure, setting boundaries, mental health knowledge, risk assessment, and interactive learning, all reinforced through supervision. Organizations need to build in protected time for reflection, mentoring, and manageable caseloads, especially for those working alone. And at the bigger system level, those who fund and manage these services need to make sure that referral criteria, job roles, and how to get help from other services are all aligned. Training alone can't fix problems with how services are set up or how different professionals work together. We need a layered approach where core skills are supported, and the overall system is aligned to reduce the burden on link workers and ensure safety and effectiveness. Now, even though this review is really comprehensive, it is important to acknowledge its limits. Most of the studies looked at were qualitative, meaning they focused on people's experiences and opinions. We don't have a lot of strong comparative evidence yet on which training methods actually work best to improve practice and results. Also, the evidence base is heavily weighted towards the UK and a few other similar countries. So these findings might not apply everywhere, depending on how social prescribing is set up in different places. Future research should definitely look at evaluating different training approaches, like supervised experiential models or context-specific training, to see if they really make a difference in how prepared link workers are, if they stay in their jobs longer, and if they make safer referrals. More research is also needed across diverse settings and countries to figure out what training should be standard for all link workers and what should be adapted locally. In conclusion, the research shows that mental health and well-being social prescribing often involves deep one-on-one relational support. The current training models often don't match the complexity of this work, which is sometimes done under challenging conditions like long waiting lists and under-resourcing. Fixing this isn't just about adding more training modules. It is about building real learning infrastructure, like supervision and reflective spaces, alongside clearer job roles and better information for those making referrals. We need to move away from training designed for simple coordination and towards preparing link workers for the intensive relational support they often provide. Addressing these gaps is key to making sure the workforce is sustainable. Services are safe, and social prescribing can truly make a difference. What do you think? Does this resonate with your experience or understanding of these roles? Let us know in the comments below. If you found this breakdown helpful, please give this video a thumbs up, subscribe to RUBIN'S Mind Lab for more science explained simply, and hit that notification bell so you don't miss our next exploration into the fascinating world of psychology and human behavior. Thanks for watching.